this story, the fire at Charlotte Maxeke Hospital a couple of weeks ago means that cancer patients have been missing out on their treatments, and lists for radiation treatment are also likely to grow, putting more pressure on an already stretched system. We're joined now by Ouma Mamatela, a patient navigator at the Charlotte Maxeke Hospital. A very good afternoon to you, Ouma. Just to start off with telling us the state of the oncology department before the fire. How many patients were you treating at the time?
At the medical oncology, it was about 150 patients on a daily basis, Monday to Friday, and it was flowing. And all the patients were getting treatment. It was just a free-flowing service. And in terms of radiation oncology, we had a backlog at the time, but some patients were seen at the time just before the fire.
How big a backlog are we talking about?
When it comes to radiation oncology, we're talking the backlog since 2019. 2020, they tried to get back to the patients that were not seen in 2019, but it's not even there. We're not even there. Currently, at the moment, it's just a huge backlog.
And what would you say is the cause of this backlog? I mean, if it spans back to 2019.
The machine were broken. Few of those machines took a while to be fixed. And in terms of that, at that moment, they had to see only the emergencies, the patients who really needed the services at the time. But currently, they're going back to those patients that really needed radiation oncology. And I mean, to be honest, emergencies are always going to be there. So it's within emergencies and also attending to few patients that were already waiting since 2019.
And what would you say the current state is now of the oncology department, especially considering that people have been missing out on treatments because the hospital had to close down when the fire actually occurred?
Right now, for medical oncology, patients are being referred to Bara. When you get to Bara, it's the first floor on hematology department. I mean, the space is too small to accommodate all the patients at the moment, but the nurses and the doctors are doing their best. But to be honest, on a daily basis, they cannot afford to accommodate 150 patients. So all our patients have to call in. Sometimes they are not seen. They are being turned back home. It's just so overwhelming for the staff, but some of the patients are still getting their treatment, but it's not the same, to be honest.
I mean, how would you say this fire has then impacted the patients' lives as well as the healthcare workers, as you're mentioning? There's a lot more that they have to deal with in terms of patients than they're used to dealing with. And also considering that with cancer, it has to be treated continuously. Are there any patients that are actually facing a risk of relapsing from the continuous mistreatments?
Look, being diagnosed with cancer, it's so nerve-breaking for each and every individual. Now you get to be on a treatment, and now it has been stopped for a few weeks. You can imagine how the state of the patients are at the moment. It's very nerve-breaking. And to be honest, the medical oncology is doing their best. Right now, they have called those patients that were already on an emergency side so that they can start with them. And on our side as well, we are also calling patients to let them know that, look, it might be a delay, but we are getting there. But the state, to be honest, it's not good for the patients at the moment.
So are patients at risk then of cancer returning if it was at bay before they started missing their treatments?
No, they're not at risk. They're really not at risk. They will be provided with the treatment as time goes, but they are definitely not at risk. It's just a delay.
So apart from the Baragwanath Hospital that you mentioned, which other hospitals are able to actually handle oncology patients at the moment?
Okay, at Bara, you go to hematology department. It's a very small space, but it's accommodating the medical oncology patients. Remember that Charlotte Maxeke is accommodating patients that are referred from Bara, that are also referred from Helen Joseph Hospital, and also Charlotte Maxeke patient as well. So it's just 3 combination hospitals, and they have to be at Bara in a small space, but they are getting there.
So What is the latest then from government with regards to how soon the hospital will be repaired and ready to receive all of those 150 patients per day for the medical oncology treatment? And also, what about the radiology patients, where you mentioned earlier on that machinery is a big problem? Will there be new machines bought? Will the current machines be better maintained?
Unfortunately, at the moment, the government hasn't said anything except the fact that they are doing their best to send patients to relevant hospital where they can get help. That's all we have for now.
Well, let's leave it there. We will stay in touch with you. Hopefully more can be done for those patients, not only the oncology patients, but other patients that used to be serviced by the Charlotte Maxeke Academic Hospital. Ouma Mamatela there, the patient navigator at Charlotte Maxeke Hospital, just telling us the dire situation that hundreds of patients face when turned away from the current facilities that are just trying to help absorb the caseload from that hospital.